note of him. But in this regard, Jacques, unless if there are any house rules that you want to state up front, I'm very keen to invite the minister for a keynote address. Jacques, do you have any house rules that you want to state as the webinar lead?
Thank you very much, Statistician General, and good afternoon, colleagues. I think basically you've got it all under control, SG. So we don't have any specific announcement in terms of rules to make. The speakers will follow one after the other. I think the most important, just to assist everybody, is that we switch off our cameras when we don't speak. But those who do speak should please switch on whilst they are speaking so that others can see them. The program will, as indicated by the moderator, through the presentations by Dr. Zulu, the keynote address by Minister Zulu, the inputs from the panelists, and it's only after the inputs from the panelists that the moderator will open up the general meeting for inputs and discussions. And at that point, obviously, participants will be requested by the moderator to raise their hands. They'll be acknowledged, and should please make their inputs and contributions as brief as possible, so that as many people can participate as possible. So that's basically the flow of everything. Person, I don't think there's any other things to add. Thanks.
Thank you indeed, Jacques. Let me, at this point in time, invite our Minister Lindiwe Zulu, to give a keynote address. Honorable Minister, you have the floor.
Hello. Yes, a very good afternoon, a good morning, good evening, you know, when we are on an international platform. Can you hear me?
So we can hear you clearly. Be comfortable to proceed, Minister.
Okay. Thank you very much. I think I must firstly apologize because Mr. Maluleke, can I apologize that Minister Mthembu, I've been told that he is unable to make it. We just broke off cabinet not long ago. He's not going to be able to make it, and I take it that Minister Mchunu will be able to deal with that element, because I'm also going to speak and I'll be here as much as I can. I'm traveling to Cape Town. So if I get lost somewhere along the line, it's not because of anything, just that I'm on the road. May I also pay a special respect to High Commissioner to South Africa, Nigel Casey, UNFPA Regional Director, and then the Julita Onabango, and Executive Director, National Population Council of Ghana. Thank you very much for being here. Dr. Leticia, Aledale, Apia, and then of course the people that are coming from the department. Jacques, I saw you there, and the acting DG, I hope he's also there. The Secretary General Union for African Population Studies. And I see here there's somebody who shares the surname with me, Executive Director for African Institute for Development Policy, Dr. Elias. The Zulus are on your stoop today, Maluleke. And then Youth Development Advocate, Levi Singh, all distinguished guests, government officials, organizations, academia, and civil society organizations present here. Allow me to first thank all of you, thank all the partners who organized this webinar series titled Demography and COVID-19 in Africa, Evidence and Policy Responses to Safeguard the Demographic Dividend. For us, the safeguarding of the demographic dividend is of utmost importance to us. So the core group of organizers who have also been part and parcel of this, the United Nations Population Fund, may I say we work very closely with them, and I wish to thank them for supporting us at all times. The British High Commissioner to South Africa for Commonwealth and Development Office, Statistics South Africa, and the Department of Social Development, the African Institute for Development Policy. That is the group of people that we wish to really appreciate for the work that you have been able to do. This group was supported by the Department of Social Affairs of the African Union, and as it is, we are still chairing the African Union, the African Center for Disease Control and Prevention, the Southern African Development Community Secretariat, the Union for African Population Studies, and the Population Association for Southern Africa. I also want to recognize all the participants from the diverse sectors and from across the continent and even beyond, because your contributions in the webinars made it possible to formulate the proposed evidence and policy responses to safeguard the democratic dividend that we'll discuss today. As we know, the African Union devoted the year 2017 to the theme Harnessing the Demographic Dividend, the future we want for Africa. The objective was to highlight the pivotal role the population dynamics can play in the socio-economic transformation of our continent through investing in particular in our youth. This thematic focus was adopted to advocate for the potential of Africa's large youth population to deliver a demographic dividend. Through these webinar seminars, this webinar series, we sought to remind ourselves that the African Union's Agenda 2063, which is still alive, and the 2030 Agenda for Sustainable Development can only be achieved by investing across the continent. Many of the developmental initiatives in all our countries were slowed down, and the livelihoods of the most vulnerable segments of our population came under threat due to COVID-19. And we're still making the message, we're still passing the message, Honorable Chair, that while we see in the news today that there is talk about a vaccine and all that, the message still goes to us, and particularly in the African continent, because in some instances, when such solutions are found, they take forever to get to our continent. But we're hoping that with the leadership that we have had of the AU and the ministers of health throughout the continent, we hope that whatever inputs we have made towards that will be assisted in making sure that we are not left behind. But the message still remains that COVID-19 is still with us, and people still have to do the right thing to keep the distance, wear the mask and wash their hands and sanitize. Every day we are passing and spreading that message, because that message must not be lost. Because even if a vaccine has been found, it's not like because the vaccine has been found, then the virus will disappear. It won't disappear, it's still here. And we have threats even within our own country in terms of areas that still really have high numbers. Scientifically, it's important for us to explore the demographic impact of COVID-19, not only because it is a disease that kills people, but also because its tentacles spread through the economy and the social fabric of societies to affect the determinants of demographic outcomes. Poverty, inequality, unemployment, compromised service delivery, all hamper the achievement of sustainable human development. The impact of COVID-19 affected the very pillars on which the demographic dividend has to be built: education and training, jobs and health, including sexual and reproductive health rights. So, Chairperson, in the Addis Ababa Declaration on Population Development in Africa, which we adopted in 2013, we committed ourselves to, and I quote, integrate responses to gender-based violence in all sexual and reproductive health programs and services, including in humanitarian situations, as part of a broader, multi-sectoral, coordinated response, which included maternal and child health care, family planning, and HIV-related services. And we recall that yesterday we were commemorating World AIDS Day, and I'm hoping that all our countries are still doing their best, so that at the end of the day, we don't think that we have to focus so much on COVID-19 and forget about the fact that HIV and AIDS is still a problem in our communities. Last week in my own country, we observed a remembrance campaign for victims of COVID-19, and the president requested that the nation fly the flag half-mast for the victims of COVID-19, and as well as gender-based violence and femicide. The Remembrance Campaign was part of the 16 days of activism for no violence against women and children, which is currently underway. I do want to say that also with regard to the 16 days of activism, it's not just those 16 days that we focus on changing the cause of violence against women and children, but we want to use a campaign that is 365 days, where we work towards ensuring that gender-based violence and femicide in South Africa should be a thing of the past, and we don't have a long time. We need to deal with it now. The objectives of the Remembrance Campaign were to facilitate a national consciousness on the prevailing devastating effects of COVID-19 and gender-based violence pandemics in our lives, including loss of lives and the economy that is struggling, to mobilize the nation to unite around efforts to stop COVID-19 infections, prevent gender-based violence and femicide, and to unite around our socio-economic recovery plans, as well as to profile remembrance stories and activities by South Africans during the demarcated 5 days period. The Remembrance Campaign also provided us with the opportunities to start focusing on COVID-19 interventions and innovations that will be sustained and retained beyond the peak of this epidemic, as well as into the long-term future. I must indicate here, honorable panelists and members, that COVID-19 actually propelled us into doing many things which we didn't think that we were going to be able to do at this time. It propelled us, for instance, to focus on technology and the improvement of technology in order for that technology to improve our service delivery to our people. Distinguished participants, we look forward to hear more details from Dr. Zulu's presentation. I can't be saying Zulu like the language. Zulu is the language. Zulu is the surname. Dr. Zulu's presentation, as well as the expert view of the panelists and the views of the participants. We must remain committed to continue to implement the Addis Ababa Declaration on Population and Development in Africa and the commitments that our governments made last year at the Nairobi ICPD 25 Summit. I trust that the report that we will discuss today will provide us with pathways to keep these commitments alive, even in the face of COVID-19 pandemic. I thank you and wish us a fruitful session. Thank you very much, Chair.
Minister Zulu, Your Honorable, we thank you so much for dealing with the keynote address that came at the opening of our webinar. But also to mention that I was getting worried, Minister, when you said Mr. Elijah Zulu. I was saying, Minister, it should be Zulu. But as I introduce Mr. Elijah Zulu, let me
Thank you very much, Chair. I had to correct myself there. Otherwise, my brother was not going to be happy with me.
Let me mention that although Minister would want to distance herself from any nepotism with Mr. Zulu, they come from the same root. The whole of Southern Africa was shaped by the movements that were triggered by King Shaka in the early 1800s. That is why Mr. Elijah Zulu found himself in other parts of the country. And when King Shaka Zulu shaped the world, there were no boundaries. That is why this webinar has no boundaries. Dr. Zulu, let me introduce you, Executive Director for the African Institute for Development Policy. You lead us in your presentation.
All right, thank you. Thank you very much, Mr. Chair. Risenga, I noted you said it's been many years since we met. We met actually the year when you were taking over as Director General at Stats SA, which is like what now? Is it 4 years ago or 5 years ago?
It's 3 years ago.
All right, yeah. So, Honorable Minister Lindiwe Zulu, I'm one of those Zulus who don't speak Zulu, but a few years ago I met the king, and when I explained to him, a lot of South Africans tease me that you can't call yourself Zulu when you can't speak Zulu. Then he told me that, you know what, it's the blood, not the language, and you can call yourself Zulu very, very proudly. So I'm here, and thanks a lot, Honorable Minister, all protocols observed. So I'll share my screen now, just to make sure that I take you through the slides that we have. Starting by also just noting that at the African Institute for Development Policy, we are really very, very proud to have been part of this process. The Honorable Minister already mentioned the 7 organizations that were involved in organizing this really very, very, oops, I think that's not the right, is it? Just excuse us for a minute here. It's, okay, Bernard, I don't know what's happening. Do you feel like you can share your slides? It looks like I'm having a challenge here. Or I'll ask Victory to share the slides. Okay, that's the only one that's open. But when I go to share, it's bringing something that is not on. I really apologize for this. I shouldn't be eating up time. Let me try one more time. Okay. All right, I'll let Victory, my colleague, share the slides. It's not showing yet, Victory. But the title, I'll get started there. In my computer, is that? Oops. All right. Okay, now it's there. I really my sincere apologies to everybody. It's the Demography and COVID-19 in Africa, Evidence and Policy Responses to Safeguard the Demographic Dividend that are based on the insights and the evidence and the discussions that happened in the 4 webinar series that we've had over time. So I'll quickly go to the next slide. The overview, really, my presentation is going to present the background, the background and objectives of the webinar series. Look at the morbidity and mortality from COVID-19 in Africa, measures that have been taken to control the pandemic, and the key recommendations that the study gave. So in terms of background, we all know that the African continent is more youthful than the rest of the globe. 60% of Africa's population is estimated to be under 25 years of age compared to the global average of 41%. The region can capitalize on this youthful population to harness, to accelerate its development through the demographic dividend. So just, I know it's kind of preaching to the choir here, but if we come up and say, what is really this demographic dividend? And if you look at these 2 populations in this graph here, you see that population A has many more dependents than workers, while population B has more workers than dependents. And when we talk about the demographic dividend, we are really talking about moving from a population where a lot of resources are invested in dependent children, where there are few workers, but then when that population, population changes to one that has fewer dependent children and more workers through a decline in birth rates, that's what actually propels socioeconomic development and economic growth in a country. So we also know that there are two demographic dividends. We talk about the first demographic dividend, which is the economic benefit that arises directly from the increase in the proportion of the working age population. So the fact that now there are more workers, the economy can produce more and so on, the economic growth accelerates, it grows much faster. But the second demographic dividend is more long-term. We are looking at long-term economic benefits from increased investments in children, but also increased savings that come from having fewer children, investments that then later on help to ignite more, to propel more economic growth in the country. The Honorable Minister already talked about the African Union's efforts. Just to note here that there's also a roadmap that the African Union developed in 2017 that a lot of governments have developed. And she also talked about the 4 pillars, employment, that it's not just about lowering birth rates. It's the countries maximize the demographic dividend when the decline in birth rates is accompanied by greater creation of jobs, education, health and well-being, but also governance and empowerment of youth. So the webinar series were done. There were 5 series, as I said. The main objective was to create a space for sharing a demographic perspective on the impacts of COVID-19 with partners across the continent, considering its implications to harness the demographic dividend as well as achieve the SDGs. So, and the second objective was to make sure that we develop policy recommendations that South Africa and other African countries could actually implement now in the post-pandemic period to safeguard the demographic dividend. So what were the key questions that were actually addressed in the meeting? These included, how do demographic age structures and indicators influence the way COVID-19 spreads and how it affects the population? That's the first big question we are addressing in this webinar. The second one was, what has been learned about data, indicators, and the measurement thereof to monitor and evaluate the impact of COVID-19 and to inform government responses? The third was, what are the possible implications of the COVID-19 pandemic on progress towards a positive and inclusive demographic dividend in South Africa and the rest of Africa? And finally, we're looking at the policy options. How do we safeguard the demographic dividend? What actions should governments take? So now I'll go into highlighting some of the key highlights in the discussions and findings that came up in the discussions. First of all, starting with the whole issue of morbidity and mortality from COVID-19 on the African continent. We all know that the first case of COVID-19 in Africa was reported on 14th February in Egypt. And at that point, there was a lot of concern about the situation because, we know that there were questions like, would Africa's relatively young population provide protection as a shield? Would higher prevalence of infectious diseases like HIV, AIDS, and malaria, for instance, compared to other regions of the world, predispose the continent to higher mortality? There were questions about the weather and the whole issue about health systems. When we saw what was happening in Italy, a lot of people wondered, are we going to have this medical stamina to deal with this problem? And then we know that by end of November, if you take the specific date, 26th of November, 2.1 million cases were reported in Africa, with 50,000 50,628 deaths, which represents 3.6% of the global burden. But as you know, if you look at Africa having about what, is it 15, 17% of the global population, this number alone just shows that the continent has really been spared of this big global problem. Below there, you see that there are big regional variations in terms of the contribution to the numbers. Southern Africa, mainly dominated by the numbers in South Africa, of course, is leading with Northern Africa, and the other two regions there, the other three regions really are contributing very, very few numbers, both on the side of deaths as well as the cases. But I think it's important to note that while the peak in many countries was around August, there seems now to be a resurgence with increasing number of cases occurring again from November in countries like Morocco, Tunisia, Algeria, and Kenya. And so this has led to really new concerns and speculation that the African continent might actually also experience the second wave in the way that we are seeing in the US and as well as in Europe. And I think this shows that we really can't relax too much, that the situation still remains quite uncertain for the future. So what are some of the key measures that our governments took? A number of papers talked about this. We knew that there was, the minister also talked about the measures that were taken, including the public health measures, hygiene, sanitization. In some cases, there have been mass screening and testing, social distancing, limiting public gatherings, flights, airports were closed for a long time, closing schools and institutions, movement, and so on, international travel restrictions. So our countries took a lot of immediate measures. In many cases, the measures that our governments took were informed mainly by the experience of the countries in the global north, because we're just then not having so much local data to inform our responses. But I think as things have turned out later, a lot of these responses really helped the continent to prevent a potential crisis that we could have seen. So how do you model the potential impact of COVID-19 on the DD? There was a presentation in one of the seminars done by Jose Guzman, who gave this model that basically when we are looking at the COVID-19 impact, it can have a direct impact on demographic dynamics by affecting fertility, mortality, which then would affect age composition down the line. But I think fertility effects can be through maybe are people going to, we've all heard about how young people who are out of school, we might have a surge in teen pregnancies, or people may not have contraception and so on. So those could have impacts on fertility. On mortality, it was the number of deaths themselves. If the number of deaths were very, very high, that could have had a big impact in changing the age structure to the extent that the distribution of the deaths would be very, very different by age. But I think as we have seen in Africa, this impact is not going to be the main impact. The big impact that will affect the capacity of governments to harness the demographic dividend will be through the social and economic impact of the DD, where we are really looking at its impact on education, on employment, on empowerment of young people, which are the other three very, very critical aspects of the DD. So when we are talking about how is the DD, how is COVID going to affect our country's capacity to safeguard the DD, it's important to be guided by this framework. But I'll just say now very, very quickly on each of the thematic areas that we are looking at here. First of all, starting with health. We know that sexual and reproductive health and rights services were disrupted to a very, very large extent. Stockouts of family planning commodities due to disruptions in supply chains, closure of some service delivery points, reduced access to services due to movement restrictions at the time when a lot of governments just came up and said, you can't move. The lockdowns like the ones we saw in South Africa and so on, people were only going out for what seemed like the most essential services or needs. The issue about unwanted pregnancies among young people, increased mental illness, and disrupted vaccination campaigns and so on. So these are some of the potential. In some cases, there's some evidence that is emerging to measure this. For instance, in Kenya, a study that was done to understand for those people who are not able to access contraception, young people aged 15 to 24 in Nairobi, during the first peak, of the pandemic, this chart here shows you the reasons that they were giving. The most named reason there was fear of being infected with COVID-19 in the health facilities themselves. And then you see unable to access services because of government restrictions, health facility or doctor's office closed and so on. So just showing that the people were afraid, but at the same time, the services were also closed. And now it will be very, very interesting to see how this changes. The issue about education. The left side of this chart shows you that in March, basically all countries in Africa didn't have school closures. The color in pink, I hope I can, shows partially opened. The is it purple shows closed due to COVID-19. Blue shows fully open, and so you can see the change that has happened. Around March, virtually all African countries had some closures and so on. But now a lot of countries are opening schools, full opening, and in some of them are not really full opening. What are the implications of this? We know that this learning was disrupted. Years of learning have been lost for many kids. There are dropouts of kids. UNESCO estimates that about 5.3 million learners in sub-Saharan Africa are at risk of not returning to school at all in 2020. I already talked about child marriages, which will have a big impact on inequalities in future, because for the most part, as this chart shows, the alternative ways of learning that came up using virtual platforms, radio or television, were actually, were not, a lot of the poor and rural children were not really exposed, or they were, it brought really a lot of inequalities in education because they don't have access to these gadgets that provided learning. And we also know from some evidence that females tend to be more disadvantaged in having phones, computers, and smartphones and so on. And the curriculum that was developed was never meant to be delivered through these alternative ways of learning. So there have been mass job losses for most countries, especially the informal sector. And in many countries, this exposed the lack of formal social safety nets to support families. There's been a large migration from urban to rural areas, especially during those lockdowns when people felt like they couldn't make any money at all in urban areas. And we know that the World Bank is actually estimating that that there's going to be a recession. The Economic Commission for Africa is estimating that at best, the economic growth in Africa this year would be 1%. At worst, it could actually go down by 4%, minus 4%. So there are really all these big challenges that we are seeing. This chart, based on a study also done in South Africa, showing that the losses in jobs was mainly people in the manual jobs, in the tertiary jobs. The rich, those who have better jobs, were able to continue. There are data and measurement challenges that we've faced during this period. Have we been able to assess the full impact of the pandemic? There are serious gaps in targeting. Who are these poorest that need a special protection? Lack of crucial aggregated data to really find who are the most vulnerable. And COVID has also disrupted data collection. In many countries, censuses and DHS surveys have been postponed. So there's need really to protect the vulnerable and the poor, especially the girls. And I'll just give the 7 key recommendations. I know, Mr. Chair, with my sort of technical issue that I faced. You're almost giving me a red card there. But let me just quickly run through these critical recommendations. One is the need to put in place measures to fully resume service delivery in the health sector that will safeguard sexual and reproductive health and rights and family planning programs, including service delivery to the youth. The second is the need to map and invest in addressing other emerging priorities. It doesn't mean even the old priorities have gone away with COVID, but we have to see, when we look at increasing gender-based violence, mental health, and so on, how do our health systems respond to this? The third one, the need to implement return to school strategies that will ensure minimal dropout and take measures to ensure that the disadvantaged groups, particularly girls, do not get left behind in the process. The fourth one is the need to deploy an economic recovery strategy that will safeguard informal sector livelihoods and jobs and extend social protection to the most vulnerable in the communities during the recovery period. Fifth is to develop a youth-centered post-COVID-19 recovery. We talk about DD as putting youth at the center of Africa's development. If we don't focus the recovery strategy on youth, we are going to lose out and we're not going to safeguard the DD. And number 6 is to invest in data and measurement to inform both the short-term and long-term responses to COVID-19 and similar episodes that may occur in future. And finally, Mr. Chair, is the need to strengthen joint efforts that leverage on regional and continental collaborations, such as have been seen in response to COVID, that have been coordinated, say, by the Africa CDC in health, SADC, and the African Union. We really need to strengthen the role of these regional bodies and continental collaborations. This should also be extended, Mr. Chair, to documenting and sharing lessons on best practices to overcome COVID among countries and regions. So this is what I had to share. It was really very, very rich information that came out of those 5 webinars. You couldn't do justice to everything, but I hope that this highlights the main take-home messages, and I look forward to hearing from the panelists on what they think about these highlights and their own take-home messages as well. Thank you.
Thank you, Dr. Zulu. Who are we not to want to take your message of fostering that regional and continental collaboration out of these developments of the series of webinars? But it's not my space to talk much on that. I would like to start inviting the panelists who will indeed deal with some of the issues from different perspectives. So this is the time for Dr. Letitia Appiah and, of course, Executive Director, National Population Council of Ghana. Dr. Appiah, you have all the floor to yourself.
Yes, thank you so much for the opportunity. Honorable ministers, distinguished guests, fellow panelists, I'm very delighted to be part of this webinar. And I must commend the previous speaker for the very elaborate and very thought-provoking presentation from the previous webinars. I must say that the COVID-19 pandemic actually presents many challenges. Key amongst them is the widening inequality that has been amply demonstrated in the previous presentation. The gaps in health and socioeconomic indicators can, of course, not be overlooked. However, in chaos, there is an opportunity to unite and take action to create lasting changes in ourselves, in our communities, and across the globe. My presentation will actually focus on 3 important opportunities that COVID-19 presents, which I think we should take advantage of and has also been demonstrated in the presentation. The considerations are: 1, our interconnectedness; 2, the role of inequality in any form of shape in the negative outcome. The presentation focused on widening inequality gaps as a result of child marriage, teen pregnancies, and the others. And so the role of inequality in any form or shape in negative outcomes are important. And then the importance of sharing knowledge as a public good for development. First, the pandemic drives home the essential interconnectedness of families and nations. Whilst individual efforts, when well directed, can accomplish much, the power of combined efforts knows no limit at individual or national levels. Thus, the prevention of the spread of COVID-19 by adhering to the safety protocols is a shared responsibility, as we all know. Likewise, reducing the unmet need for family planning, preventable maternal deaths, and gender-based violence, including child marriage, is also a shared responsibility. All stakeholders, including especially the religious and traditional authorities, with governments taking the lead, it's important. You know, we all know the urgency of addressing population issues. There is, however, inadequate knowledge on the linkages between population and development at every level. The fact that not meeting the reproductive health needs of every individual affects all citizens because of negative consequences in all sectors should be the primary focus, as has amply demonstrated in the presentation, widening of inequality gaps. It will be difficult to bridge the inequality gap, and inequality in any shape, including reproductive health, does not support sustainable development. I think we really have to come to that firm conclusion that inequality in any form or shape does not support sustainable development. Population and development should thus be a pro-health and a political agenda in the country and also on the continent. The second is that the virus does not discriminate. It may exploit our inequalities, thus worsening our individual and collective well-being. The worst health and economic outcomes are amongst the most vulnerable, without considering the underlying socioeconomic conditions. Asking individuals to shoulder the burden of COVID-19 response assumes that they have the privilege of participating in social distancing, hand washing with soap and running water, and remote working. This approach largely ignores the environment many people are living in, which plays a large part in determining the choices they make. An example, asking a family of 5 sharing one room with no electricity to adhere to social distancing and the other protocols, you know, will be very challenging. Likewise, asking poor people with little education in a patriarchal society to shoulder the burden of informed fertility choices ignores the environment they are living in. Although public health emphasizes human dignity, compassion, and social responsibility, local philosophies are more important than individual choices. The pandemic is not discriminating, and any human being can be infected. However, those with underlying conditions are bearing the biggest brunt, and so should be the focus. And of course, is the focus of COVID-19 response. These underlying conditions include, but are not limited to, old age, diabetes, hypertension, obesity, but it will include poverty, malnutrition. In the same vein, ineffective population management, avoidable high-risk pregnancies, which are too early, too close, too many, and too late, should occupy center stage. Anything else, especially now, would actually be unacceptable. The third is knowledge sharing. Since knowledge is a universal good, COVID-19 preventive measures are essentially interventions to help reduce the number of infections. We are all expected to understand and use the acquired knowledge, and also to do our part. This is an evidence-based, action-oriented intervention which has changed so many lives, including health, education, religion, and our cultural values overnight. In COVID-19 prevention, thankfully, science and facts, not opinions, nor harmless, at times harmful cultural practices, such as hand washing and hats, were adapted to replace scientific knowledge. Translating, sharing, and the use of scientific knowledge is therefore critical for our survival as individuals and as a collective. Sustainable development has been defined as when knowledge informs decisions at the individual, community, and national levels to bridge the inequality gap and improve our collective well-being. Enough scientific knowledge abounds about the negative consequences of too early, too close, too many, and too late pregnancies in individuals and national development. However, some societies also hold dear to these outmoded practices, such as child marriage, which we all are witnessing could widen the inequality gap, and female genital mutilation that have outlived their usefulness in the 21st century. When will we actually appreciate the fact that our current knowledge can challenge the status quo in Africa, and at the same time, challenge some of the practices that we hold dear to our hearts, such as child marriage?
Dr. Appiah, may I request that you wrap up, please?
Okay, yes. So I would want to conclude by saying that effective integrating population dynamics and demographic dividend, our leadership should reposition the critical, important role of evidence-based, action-oriented interventions, acknowledging and respecting the interconnectedness of people and bridging the reproductive health inequality gap for sustainable socioeconomic development. Thank you.
Thank you, Dr. Appiah. I need to apologize. I have not come in the middle of input by panelists, but I was reminded by the people who are handling me that I should have indicated that we have 5 minutes per panelist. So I will try and request the next panelists to keep to the 5-minute uptake. And at this point in time, let me welcome Dr. Jacques Emina, Secretary General of the Union of African Population Scientists. Dr. Emina, you lead us as the next panelist.
Yeah, thank you, Mr. Chair, for this opportunity. I may not take the 5 minutes as you have been you granted me, because I think most of the information Dr. Elia Zulu has provided. So I will discuss mostly about the data issue. So Sub-Saharan Africa is really at the bottom of the to achieve the sustainable development goal.
My apologies, Dr. Emina.
Yeah.
You have muted your camera, and all the participants have so much love of seeing you, if possible. We really appreciate this. Thank you.
Okay. Thank you. Yeah, I was saying that data is a key issue on about Africa, mostly because to monitor, evaluate all the intervention to achieve the Sustainable Development Goal, and also progress regarding intervention related to the COVID-19, rely on the good data. However, our data system, starting with the available data that mostly the national survey data, they are having problem to get those data. And also the health information system is having problem, the quality of data and availability of those data. So my key point here is how African country can get to data revolution, how African country can go to the democratization of the data. I think we should rely first on the routine data that came from the health information system and administrative sources. So in different countries, several countries, we have data from different sectors: health sector, education sectors, and other socioeconomic sectors. If we can be able to create an integrated data system that can take the data from different sectors together, we'll be able to monitor the progress in every sector, including the health sector. The second one is about the definition of our indicator. Most of the time we have discrepancy between definition, and let me give example of the age. Age data from the health data, you will have maybe 0 to 4 and 5 and plus, 5 and above. You go to education, you have a different boundary. So, one of the challenges, one of the goal here should be standardization of the definition and the indicators. And also, what is the level of aggregation? What are the, from what lower level we should collect the data? This will allow us to compare and to assess the progress of the different intervention and also on the policies. So this, our reflection from the UAP's point of view, we need to strengthen the data system, and those data systems will be integrated from different sectors. Because another point is about the health and demographic surveillance system. So those data are there, but most of the time they are not representative of the country. So if we can integrate health and demographic surveillance system and also the health system plus other sector, I think we can be able to measure the impact of the COVID and also the progress regarding other sector of the development. Thank you.
Thank you so much, Dr. Emina. Let me indicate that you are following from what Dr. Appiah raised, because Dr. Appiah raised the issue of knowledge sharing and the whole issue of availability and accessibility and quality of data, creating that interconnected picture that Dr. Appiah spoke about. Let's continue on the same narrative. And of course, in this regard, we would like to call Mr. Levi Singh, a youth development advocate from AFRIAN, which is a trust, and Mr. Singh will lead us in this regard.
Thank you, Mr. Facilitator, and greeting to the rest of the panelists. I would like to appreciate Dr. Zulu's presentation. I think it's incredibly relevant, and I would just like to echo some of the sentiments and bring a sense of urgency to this discussion in terms of what we believe needs to be done as young people to ensure a robust recovery from COVID-19 and imagining a post-pandemic world. So the first one I'd like to highlight is that we need to focus on basic education and returning and retaining young people within the basic education sector until to completion. It's quite worrying that pre-COVID-19, it's estimated that 60% of African young people had only completed primary school and hadn't completed the full quadrant of the basic education sector. And this is quite worrying data to consider prior to the onset of COVID and prior all those school closures. 4 months since we've reopened schools in South Africa, there's still an estimated 56,000 learners who have not returned to the basic education system in South Africa. And this is reported from our Ministry of Basic Education. So from a youth perspective, we would say that we need African governments in the developmental sector at large to ensure that barriers to completing basic education are eliminated through progressive partnerships with communities so that our brothers and sisters are able to complete their basic education for more future. The second component, which also has been echoed in Dr. Zulu's presentation, is the importance of health. Just yesterday, we had commemorated World AIDS Day, yet AIDS remains the single leading cause of death of African adolescents and young people, with an adolescent dying every 45 minutes due to a preventable AIDS-related illness somewhere on the continent. As young people, we believe that we can't talk about a robust, equitable, and sustainable pandemic recovery when we are losing large portions of our future workforce to premature morbidity and mortality. We need to listen to young people and meaningfully involve them in the design, implementation, monitoring, and reporting of public health policy and programs so that they have a sense of ownership of their health, as well as the health of our nations, families, and communities. I liked what Dr. Zulu had indicated in his presentation around looking at a youth-centered post-pandemic response. And I think especially when it comes to the health center, we need to look at what a youth-centered health sector and future-focused health sector looks like for our continent. Secondly, or thirdly rather, regardless of this pandemic, we understand that climate change is still the greatest existential threat to the continent. The IPCC has been telling us that Africa is warming at 2 times the rate faster than the global average. This makes droughts, famine, and extreme weather events such as flooding and cyclones a reality of the present and of the future that we need to take into consideration as we talk post-pandemic recovery. With climate change and extreme weather events having a disproportionate effects on the lives of women and girls of our continent, we need governments to focus on gender-responsive climate risk mitigation and adaptation strategies. In the midst of this climate emergency, there's also profound opportunities for inclusive growth, with research from the New Climate Economic Society suggesting that bold climate action could deliver at least $26 trillion in global economic benefits between now and the year 2030, and generate over 65 million new low-carbon jobs by the year 2030, primarily on the African continent for Africa's young people who are already experiencing a job and employment crisis. The fourth area I'd like to highlight really briefly as I round off is the importance of governance and accountability. And with Africa losing an estimated $90 billion, or around 3.7% of its continental GDP, to illicit financial flows, corruption, and maladministration, we need to take a firm stance against all forms of corruption everywhere. In Africa, rampant corruption and maladministration isn't just a threat to our post-pandemic recovery, but rather an existential threat with profound impacts on our generation and generations to come. We need to revisit our social contracts and ensure that we have a responsive, accountable, and principled leadership as we attempt to co-create the process of the socioeconomic recovery with the young people at its center, as Dr. Zulu's presentation had indicated. And then lastly, rounding up, the importance of the issue of intergenerational justice and leadership in imagining a post-pandemic and new social economic contracts. As rising debt burdens the continent and as we stare down the vivid reality of our first continental-wide recession in 35 years, we need development actors to be mindful of how this generation of young people will be responsible for shouldering the debt of poor fiscal decisions and conditions of which we had no hand in creating for generations to come. We need the development sector as a whole to reaffirm their commitment to sustainable development, which is premised on the principle of intergenerational justice, which simply refers to the moral obligation of the current generation in power to leave opportunities for good and fulfilling lives for future generations. As we rush to embrace new normals, may we realize that intergenerational leadership and calls for it can no longer be slogans or tokenistic affirmations, but rather a new necessity in a post-pandemic world for post-pandemic recovery, which will be heavily reliant on the energy, aspirations, and leadership of us, the largest cohort of young people in Africa's history. I thank you, facilitator, and I'd like to appreciate the time of the rest of the panel. Thank you.
Thank you, Mr. Singh. Let me appreciate your message of illicit financial flows that will hamper our development and recovery as Africa, but also the link on the issue of intergenerational justice that we need to take forward for our own development. I have indeed the honor to the Commissioner to South Africa, Mr. Nigel Casey, MVO. Your Excellency, the stage is yours.
Thank you very much indeed. And may I say, very good to see Minister Zulu and other distinguished panelists on today's webinar. And thank you all very much indeed for some really perceptive comments. Let me try not to repeat some of the important points which have been made already. Just to remind ourselves of the basics. We all knew that the demography of this continent meant that we needed to invest heavily in education, in health, in skills, and in creating an economic environment conducive to job creation, so that this demographic dividend that the continent can enjoy is that and not a burden. The effect of COVID is to make that all the more important, because the impact has been devastating and deep. One of the previous speakers mentioned overall projected 4% fall in GDP in Africa. Well, in the UK, we're looking at projected 11% fall in GDP. In South Africa, projected 8% fall. So these are really big numbers, unprecedented, really, and very serious impacts on employment already. So we know that if we had to work hard before to realize the benefits of a demographic dividend, we now need to work a lot harder. And that's why in the UK, we've put so far £1 billion towards supporting the global response to COVID, especially in vulnerable countries, while we're investing in vaccines and diagnostics and therapeutics, while we've put money and become one of the leading donors to ACTA and COVAX to make sure that vaccines, as they become approved, become available to all countries, not just in Europe. It's why we've made sure that extra resources have been available to the World Bank to fund vaccine purchase and rollout in upper middle income countries. It's why we've been keen on the G20's debt suspension initiative, and it's why we've wanted to support Africa's efforts through the African CDC and the WHO regional office, why we pledged up to £20 million to the AU's coronavirus response fund in June, and at a country level around the continent, we are trying to help support individual countries' responses. In South Africa, for example, giving 50 million rand to the Solidarity Fund. So there are, from our perspective, there is a very clear recognition of the need to recommit ourselves to many of the things that we knew that we needed to do before COVID came along and disrupted our lives. And we're going to carry on working with partners like South Africa, like Kenya, and others around the continent, who we're proud to work with in places like the Generational Equality Forum to maintain the momentum and maintain momentum on implementing the Beijing Platform for Action for the advancement of women, to promote gender equality, the rights of women and girls more broadly, to advance the agenda in respect of preventing early and forced marriage, FGM, gender-based violence, and other harms. So we are, despite a difficult fiscal and economic environment, we're not going to step back from that commitment, and we're keen to carry on partnering South Africa, the AU, and other African partners in meetings like these, sharing technical expertise, sharing data, sharing research and innovation, and supporting all the things that we know need to be done to harness and make a great positive out of Africa's demographic dividend. So thank you for this opportunity and look forward to the discussion. Thank you.
Thank you, Honorable, Your Excellency, my apologies. Thank you indeed, Your Excellency. And indeed, let me note your message that you brought right at the end about the issue of inclusion, particularly the rights of women and girl children, a matter that we are seeing a lot in the data that we produce. Our last panelist is Dr. Julieta Onabanjo. She's Regional Director for the UNFPA Ezaro, which is the region on the southeastern side. But let me allow her indeed to take us through her input. Dr. Obananjo, you have the space to lead us now.
Thank you, Statistics General Risenga. Honorable Lindiwe Zulu, all the distinguished guests, Ambassador Nigel, the fantastic panel. I think, SG Risenga, it's, you know, by the time you get to an end of such a distinguished panel, there's very little left to say. And so maybe I should start by really appreciating how eloquent this panel has been, and the keynote address by the Minister Zulu, and also the recommendations and the presentation by Elias Zulu. A real deep appreciation to the government of South Africa. I think where we stand as the UN system agency that is really given the mantle to move forward on the ICPD agenda, and of course on the demographic dividend within the context of the continent. You know, South Africa has been so critical to that. So really wanted to appreciate the South African government, the UK government as well, and really all the partners, including our academics and researchers, AFIDEP, UAPS, PSAA, and of course AFRIA and our youth network. I think it is important to recognize that you know, it's webinar series like this that really ensure that we can stay engaged with an agenda. And if you were to ask me, you know, what were the two things when COVID hit that really worried me? I think one was this whole sort of rollback of some of the sort of achievements that we have seen and that the Nairobi summit clearly put on the table as not only progress in the last 25 years since the ICPD program of action, but also an unfinished agenda that we all made very elaborate and bold and exciting commitments and recommitments to ensure. So really for us, you know, COVID continues to be one of many, of course, stumbling blocks and really for us a global one that has continuously challenged the progress towards the fulfillment of commitments of rights and choices under the ICPD program of action. And, you know, so we take it and in a way we use it to the best of our ability. And I think one of the things that we've looked at is really how can we use this time and this point to really, as you say, not only safeguard the demographic dividend agenda, but also just our development agenda as we move forward. And really, I think the recommendations that have been put forward from the really 4 excellent webinars, and if you haven't had a chance, please listen to them because they had speakers who really unpacked what I think is critical for the way we move forward in the policy arena. I do feel always optimistic about the continent, sometimes, you know, really worried, but I think for the most part, when we reflect back, the milestones that Minister Zulu spoke to, what we did, the magic that Jack, I know, did when we met in Addis in 2013, October, to really chart our way about our Declaration on Population and Development and how member states came together to define that. Similarly, the theme of the 2017 and the roadmaps and all the work that AFIDEB and others have done to really do those investment cases around the demographic dividend and what it would mean if we invest and the returns on that investment and the advocacy. And I think also, and I want to acknowledge Dr. Appiah, because of course we met in 2018 at the Addis Ababa +5 to really again reshape the commitments that we had made and to look at emerging patterns. And that's where things like really the inequities, the issues of also migration, climate change, of course, came to the forefront. So I think we have a lot to reflect back on to give us that optimism and hope to move forward. I think for us, from our vantage point as UNFPA, I think what worries us is the really, and I think Levy, you spoke to that, not only the accountability, but the urgency that we came out of the Nairobi summit with, and that almost screeched to a halt in 2020 with the COVID sort of distractions, and fair enough indeed. And of course, we've adapted and we've pivoted in terms of our program and taken the opportunity. But really, political will around population matters is not always constant, and it's always hard. And so, really coming out of Nairobi and then being faced with a diversion of that meant that we worked extremely hard to continue to position. And I give an example. In East and Southern Africa, the intention was the minute the Nairobi summit was finished, we would work with national governments to really take forward in action plans their commitments that were made. And we had 471 commitments coming from Africa. And so we really wanted that to happen. I can assure you that many countries have not reflected on those commitments and built them into even COVID-related national plans. Even at global level, it was only till about 2 months ago that we established what, of course, Minister Zulu is part of, the high-level commission on tracking the commitments that were made. So I think we have lost ground in terms of time. I know that we haven't lost it in terms of political commitment. I think the second thing for us was this whole financial sort of fiscal sort of space, and Ambassador Nigel spoke very eloquently to what's happening in that, in terms of the recession that we see, in terms of economic downturns countries sees. And of course, financing sexual and reproductive health and population matters at the best of times is tough. We went into, again, the Nairobi summit with a costing of what it would take to reach zero on preventable maternal deaths, on unmet need for family planning, on gender-based violence, including FGM and child marriage. And we came out with a budget of 264 billion. And when we looked at what is already invested, we saw a gap of 222 billion to achieve. And if you take that even to granular level, we know that the investments typically for reproductive health and maternal health services, including post-abortion care, is as small as $18 per capita per annum. We need 6 times that amount to be able to deliver. So we really are far back already. And even commitments that were made by private sector at the Nairobi summit, these were pledges that we really still need to. So as there is more money, and again, Ambassador Nigel, you spoke very eloquently to how much the UK government is putting into the COVID response. We can't afford to divert resources from the UNFPA supplies on contraceptives and some of the basic funding for sexual and reproductive health, gender-based violence, and issues of child marriage and FGM. And I know those will continue, and we need to look at innovative financing as a way forward. So what opportunities can we leverage? And I think colleagues have spoken fantastically to the recommendations. And I think, Levy, you just crystallized and put the cherry on top when you spoke about intergenerational and youth really being in the forefront. But maybe just 2 or 3 others that I think I just wanted to emphasize. I think the first is data, and I do believe our colleague Jack Amina spoke to data, Appiah spoke to data. And I just wanted to inform you that the UN system at the Africa level is working with UNECA, with the Africa Union, to look at this whole notion around what you called the data revolution for Africa, but just really a very concrete Africa strategy and plan that looks not only at knowledge, but the data platforms, and really integrates them, disaggregates them, and makes them real time, so digitalized.
My apologies, Dr. Abananjo. I will request you
Okay.
to slow down, please.
And maybe the last, and of course, the regional cooperation with the African Union, I think, is key. The Africa Continental Free Trade Agreement needs to be reinforced and brought back to life. But really, it's how do we position population within that socioeconomic recovery? And I think there's so much potential, the BRICS, collaboration, the funding that is coming, and we talked about climate financing and really how we integrate within that. So really, I think an exciting set of agendas to leverage. UNFPA continues to be fully committed to the partnership that we share and the opportunities that exist within our regional institutions and definitely within our youth population group. I thank you, Risenga.
Thank you indeed, Dr. Obananjo, and I want us to...
Onabanjo, and I'm going to correct...
No, Onabanjo, my apologies indeed. How can I mutilate your surname when I've known it since time immemorial? But indeed, let me thank you, and of course, take straight to the point that you're raising on the agency and the political will coming out of the Nairobi summit, and how we need to move forward quite speedily on some of those commitments. We have about 30 minutes of interactive discussions by participants, but I will request that Bernard Onyango presents us with the first question. And this question was sent to all of us on menti.com. So I guess you have been able to log on, but Bernard will lead us on this question before the participants start the discussions. Bernard?
Okay, thank you so much. Just to alert you how you will join the poll. In the chat box, I've put the instructions there, and I'm going to flash that also on your screen. So just go to www.menti.com and use the code 45057. So you can do this on your computer, or you can also do it from your mobile phone. I'm just going to hold on. Yeah, I hope everyone can see that. So there are two ways. You can either go to www.menti.com and use the code 45057 for those who are more tech savvy and use their QR code apps. You can also just use that QR code and it will get you there. So I'll give you a minute to get on. But meanwhile, I want to also take this opportunity to request that everyone at this moment, if you could all turn on your cameras so that we can actually capture the session. My colleague Anne will capture that. We'll do the screen capture of that so that we have a record of those who attended. So please, I request as we go to the poll, let's, could you just turn on your cameras? Great. And Anne, please, you can take over on taking taking the photo, so you can lead us on that. And so
yes, thank you, Ben. Perhaps you need to stop sharing the screen first.
Oh, okay. Let me stop sharing the screen. Okay, we'll go back to my screen in a minute. So let's capture the photos.
Almost there. Anyone else? Okay.
Okay, thank you so much, Anne.
Wait. Perfect, thank you.
All right, great. So are we on menti.com? Have we managed to log in? Okay. I only see a few people.
Can you put the code up for Menti again, please?
It's 45057. Let me go back to the screen. Can you see it? Yeah? Please, let's all try and get in there. Yes, they're coming in a bit slow, but we'll get there. So we almost 40 people on this, actually more than 40 people. So only 10 have managed so far. Please let's try and get through it so that we can get to the rest of the program. $12 so far, 13, 14. Yeah, I think we are now catching up. 15. Let's keep it going. Okay, so when we get to over 20 people, at least more than half, then I may need to move on lest the moderator cuts me off. So, okay. I think everyone can, I hope you can all see the screen and the word cloud that's forming there from your top 3 takeaways. And I think at the moment, for certain, we can see one of the most dominant words that's coming up there is youth. And we also have partnerships and collaboration, funding, education. So I think these are some of the key things that people highlight that participants are picking up from this. I think obviously the issue of youth is really at the center of how we move forward on the demographic dividend agenda in Africa. But also, I think it is very useful to see that partnership is coming up quite strongly. We can't really do it without partnerships. So I'll move away from my screen and I'll let people vote. There'll be a second vote, but we'll hold on for that. I'll turn it over to the moderator, the SJ, to continue the program. And at the end of interventions from the floor, we are going to get back to a second poll. Thank you.
Thank you, Bernard. We have to allow a few comments on an interactive discussion amongst the participants at this stage. But of course, Bernard, you still have your next question, which will come after a few minutes of interactive discussions. We don't have much time to take a lot of hands, so I might need to be assisted in checking how many hands we could have. I would be keen to take not more than 5 hands that will be brief in this regard. I haven't seen any hands so far.
Yes.
I can see Adinan's hand is up, but let me see more hands because I'm about to close on hands. I need 5 hands. I'm going to close on hands. For now, let me close and say we seem to only have 1 hand from all over Africa and the world. Adinan, represent us, please.
Thank you very much, Mr. Chairman. In fact, I just want to thank Government of South Africa for the series of webinars organized over these almost 1 month and a half, and concluded by this exceptional one. Also want to congratulate Government of South Africa, represented by Her Excellency Minister Lindiwe Zulu, to be elected as the chair of Partners in Population and Development, starting from 2021. We had a very exciting webinars, and we all learned from experiences from many countries, from many experts, and also policy representatives from different organizations about the COVID-19 impact on sexual reproductive health, family planning, and also population dynamics, including the demographic dividend. I think it was an excellent sharing of knowledges, experiences from different countries. Today, I'm happy to see Madame Laetitia Appiah, PPD board member from Ghana, also presenting a very good presentation on the issues related to child marriage, teen pregnancies, and also the integration, and also knowledge sharing within African countries. Elia Zulu made a very good presentation as usual, and I thank Elia for his contributions to many organizations, including to PPD, to Partners in Population and Development, about the demographic dividend, and also the work he's been doing in leading the AFIDEB. It is important to mention that we have a lot of work to do all together. That COVID-19 left us in a situation that we need to bring our efforts all together at national level. Because for global pandemics, for global problems, we need global solutions. But these global solutions should start from the community. It starts from the national level. It goes to the regional, and then to the global. COVID-19 has, showed us and demonstrated that health system need to be strengthened, because healthy society will lead to social and economic development. It's not the opposite. But also we need to work, and we need to bring our efforts together to ensure that this COVID-19 will be addressed by all the stakeholders, by governments, by the private sector, by international organizations, and also by the professionals. Youth is important. We have to rely on youth engagement. And I really appreciate the intervention from Livicine. We all think about the youth, and PPD just last week, a technical session within its International Interministerial Conference on South-South Cooperation, Population and Development on youth engagement. And we have seen very good examples from young people about their engagement and their commitment to, of course, to address the COVID-19 situation, and also in implementation of the Nairobi Summit. Before I conclude, I just want to say that we are also having PPD with UNFPA and also the National Health Commission of China. Will have our International Interministerial Conference. We had conducted 2 technical sessions, and the next one will be held on 8 December. And together, I think all we have to bring our efforts, and also we'll work together. On 8 December, our ministers will discuss about the what countries can do to address the COVID-19 situation in the developing world, but also what they should do to implement the Nairobi commitments. Thank you very much, and wish to see you all on the 8th of December. Thank you.
Thank you, Adnan, and thank you indeed. Adnan Benhaj Isa comes from the PPD, that is Partners in Population and Development, and for the invitation. I don't see any hands on the screen, and if I don't see hands, I'm inclined. Peter, I see you've put your camera on. You want to give some input? Not at the stage, so let me take Mark. Mark Collinson, I see your hand. Let me take Mark's hand as the last hand in the interest of time. Unless if there are other hands that want to come, I would recognize them, and then I would note them and then recognize them later. We seem to be running short of hands. So Mark, please take the stage. I'm muted, Mark. Your mic is muted, so you will have to start.
I'm muted, yes. Apologies for that. Yes, the discussion on data that several of the panelists spoke to, and in particular Professor Emina, which brought, and he specifically mentioned health and demographic surveillance. And we've been getting compliments as a South African community at government level, at statistics level. And I wanted to mention, Chair, but you chair this too, in the Department of Science and Innovation, the ambition and already delivery to have national data and longitudinal data contained in a way that can be made compared and brought strength from each type of data. I thought that the work of science and innovation to talk to the kind of issue that Jacques was raising was very relevant.
Thank you, Mark. Thank you indeed. And let me, on this note, close on hands and allow Bernard to conclude on the next question so that we can go to the way forward by Jacques. Our program will change right at the end, as Minister Zulu has indicated, that in this regard, Jacques van Zytman will deal with the way forward and the closing statement instead of Minister Jackson Mthembu. It will be read by Linton Kunu, who is Acting Director General at the Department of Social Development. So at this point in time, let us allow Bernard to deal with the next set of issues. Bernard, you have the floor.
Okay. So thank you, Jeff, and this really important question. So what we'll do as we are writing in the poll, we can also have, given that we are running out of time, we can also have people to lift up their hands for an oral intervention. But the question really is, we are looking at this particular webinar to also consolidate on the recommendations and prioritize them. So as you can see, the question there is, what are your top 3 priority recommendations from the list provided? So we have a list of about 8 recommendations there, and I hope you're able to read that. And so if you could just again go to the poll, I hope you didn't shut off your poll. You should be able to respond to this question. So please, let's get on with it. And meanwhile, I think as people are filling up this, we can have oral responses on, what have been your takeaways from the webinar series, and what are your top recommendations. I will use the poll just to make sure that everybody is able to have a say, since not everybody is going to be able to talk. Thank you. So we have 10 responses so far. I hope others are getting on with filling up the poll. The pace seems to have slowed down. We only have 13 who have responded so far. Please, let's respond to the poll. We need to move on to the next agenda item. I'm going to close in the next 1.5 minutes. So please, let's get it done. We have 16 responses so far.
Bernard, I want you to conclude. We have to take Jacques. Yeah.
All right. Thank you, SG. Let us. You can go ahead. I think people can continue with the ones who are still polling can make their responses, and you can go ahead with the program. But you can see I think the priorities they're really neck and neck in terms of what people think we should prioritize. So thank you.
Thank you indeed, Bernard. And I would like to encourage that we continue polling for those who have been polled. In our culture, they say that all cattle must come home. But otherwise, let me allow Jacques van Zeidman to take us on the way forward. Jacques, I will allow you, I will be very generous. I won't give you a minimum. A minimum is too small for you. I'll allow you a maximum of 5 minutes. So you have the maximum. So just go ahead, Jacques.
Thank you very much, Risenga. You really sound like a statistician there. Good afternoon to all participants, all protocols observed. For us, it is quite clear that from the entire webinar series, as well as the contents of the synthesis report, that governments on the continent will have to come up with strategic and targeted short and long-term recovery programs if we want to safeguard the demographic dividend in Africa. Concerted action is required to address key priorities to ensure that Africa achieves the demographic dividend. Indeed, some countries have already put in place sound plans, but we think we should find a way of coordinating and aligning these across the continent, and this is why the work being done by intergovernmental organizations is important. The South African government, as outgoing chair of the African Union, will undertake to formally hand this report and its important policy recommendations to the next chair of the African Union, with a request to continue with the work that we have started. We will ensure that this work is not lost, but continues and gains further momentum. We shall also seek to continue to work with the African Union Commission's Department of Social Affairs, the Secretariat of the Southern African Development Community, and the United Nations Population Fund to develop targeted projects and programs to action some of the recommendations that are contained in the work report as an important contribution to ensure that we realize the demographic dividend for all the countries in the continent. We would also like to encourage that this work filters through to all the regional economic communities. Program Director must also reiterate our commitment to continue our collaboration with the United Nations Population Fund, British Commission, South Africa, and the Foreign and Commonwealth Development Office, the African Union, the Partners in Population and Development, CDC, AFIDEP, UAPS, PASA, to advance our shared commitment to the international population sustainable agenda generally, but specifically also to build on the momentum that was generated through this webinar, identify, develop, and implement follow-up and or spin-off initiatives in the domains of evidence-based research and data analysis, knowledge sharing, and capacity building. To conclude, dear participants, we shall continue to promote and advocate for a positive, human rights-based, inclusive demographic dividend in Africa, Southern African region, and the continent. Do so in the context of Southern African development community. Thank you very much.
Jacques, how can you surprise me by being so generous with time? You actually kept it so close to lower than the time I had given you. But I really appreciate this, Jacques. Now, at this point in time, with the way forward that Jacques has given us, we need to take the marching orders. But I think amongst other things, the marching orders is to always remember the Nairobi summit and be able to march and in our charge towards achieving some of those objectives, especially as a continent. In this regard, let me invite my one and only brother, Linton Mkunu, who is acting Director General for the Department of Social Development, who, for whatever reason, time has treated a lot more kinder than it has treated me. My brother, you have the floor.
Comrade SG, thank you very much for the introduction. I thought that you would also follow through and then congratulate me in my appointment as the minister. As you heard, she promoted me to a minister when she delivered her speech. But thank you very much, SG. Ladies and gentlemen, so that I don't forget everybody who is here, all distinguished guests, and indeed all protocol observed. Of course, as COVID-19 spread into our country and region, the South African government adopted a national state of disaster and a risk-adjusted strategy with 5 alert levels, primarily to respond to the adverse impact of the pandemic, whilst doing our utmost to protect the livelihoods as well as economic activity. I often say that the world we left in March is a world we will never get back into. And the world we entered into is a completely new world, which has commonly become the New World Order. I call it, or rather, which has commonly become the new normal, and I call it the New World Order, specifically because the impact and effects of this invisible enemy will be felt for a very long time. As has been observed and reported widely, including during the webinar series, the pandemic reaped absolute havoc on economic growth worldwide, including in Africa and in South Africa. Many jobs have been lost, which have still not been recovered. Some of the social implications of these economic challenges were seen very quickly. For example, an increase in hunger and health sector programs, placing high demands on the public sector system overall. Other social impacts may only start manifesting themselves over time. And as we count the cost of reduced schooling over the past few months, especially in the historically disadvantaged parts of our country, as well as other consequences of higher unemployment, increased poverty, and consequently deepened inequalities. Whilst we continue to modify our risk-adjusted strategy as a country in preparation for a possible second wave of the pandemic, we also had to take a longer-term forward-looking approach to bringing our National Development Plan, the NDP Vision 2030, back on track, and indeed to revive our economy. Most importantly, our government made available an unprecedented amount of 500 billion rands for social and economic relief as a package to cushion the impact of COVID-19 on the most vulnerable groups and small businesses and cooperatives during these difficult times. And as an immediate impact, we were able to safeguard some jobs, some SMMEs and cooperatives, and indeed reduce the risks of malnutrition and food insecurity, especially to the most vulnerable and the poorest in society. Recently, President Ramaphosa announced the country's economic reconstruction and recovery plan, which is drafted in consultation with our social partners, including business and civil society organizations, was central to our developmental agenda. The plan has 2 themes: recovery and rebuilding the economy in a manner that ensures sustainability, resilience, and inclusion. We recognize that the further integration of the economy of the African continent is a critical enabler for the work plan, for the plan to work effectively. It is exactly for these reasons that the report on the webinar series is so important and very well timed. The inclusion of young people, particularly young women, will be critically important if we are to achieve a long-term sustainability of our economic reconstruction endeavors. This is true not just for South Africa, but indeed the entire African continent. Our future resilience to shocks that come our way, be it in the aftermath of COVID-19 or any other health and natural disaster, will depend on the investments that we make into our young people and to our young human capital right now. And as you're aware, young people are our greatest assets on the continent, more important than all the gold, the platinum, and the coal that we have in our continent. Chairperson, we certainly welcome the recommendations that have been made during the 5 webinars to safeguard the demographic dividend from the impact of COVID-19. And we agreed that governments, in collaboration with each other and other sectors of society, will need to come up with strategic and short-term and targeted, rather, short-term and long-term recovery strategies. Many of the key priorities that have been listed resonate well with and build on the commitments that the South African government and many other governments made at last year's ICPD 25 summit in Nairobi. Amongst others, the Department of Health introduced a new and very comprehensive National Integrated Sexual and Reproductive Health and Rights Policy last month, which will be instrumental in the full resumption and expansion of services during delivery, rather, to safeguard SRHR and family planning programs, including service delivery to the youth. We also remain fully committed to address other emerging priorities that have been observed to have intensified during the pandemic, including sexual and gender-based violence and femicide, and mental health. President Ramaphosa has also called COVID-19 and gender-based violence and femicide the twin pandemics, as they have ravaged society greatly, but also because they are pandemics that are caused largely by behavioral change. And as a government, we have propelled preventative programs on behavioral change. Chairperson, we agree that our post-COVID-19 recovery strategy must be youth-centered, and in particular, must implement return-to-school strategies that will ensure minimal dropout. This is why we have deliberately chosen to work closely not only with the private sector as government, but also with civil society. We do this because we believe that together we can do much more. Chairperson, the experience of COVID-19 and our responses thereto have underlined the importance of data to support evidence-based decision-making. We welcome the recommendation that we should invest in data and measurement to inform both short-term and long-term responses to COVID-19 and similar disasters that may occur in the future. Lastly, Chairperson and distinguished guests, allow me to conclude by echoing the recommendations that we should strengthen joint efforts that leverage on regional and continental collaborations, such as has been the case with the response to COVID-19, coordinated by the African Center of Disease Control in Health and SADC, and the African Union on Socio-Economic Priorities. As South Africa Chair, we commit and recommit that we shall actively promote the recommendations of these webinars in our government, as well as in the intergovernmental context that we work in. I thank you.
Thank you indeed, Linton. And let me thank particularly the message that you have given us, one of those that commit South Africa as a country to continue to safeguard the demographic dividend. And as we say so, rally along everyone in the world and indeed work with the African colleagues, brothers and sisters to make sure that we succeed as a continent. Let me thank the participants, but let me thank specifically, and it means no seniority. There are so many senior people in this webinar. But let me thank the presentation that has come through from Dr. Elia Zulu. And as I do so, let me thank all the panelists that have led in their discussions and unpacking further the presentation. And lastly, Minister has had to take leave of us, Minister Lindiwe Zulu, Honorable Minister for Social Development. Let me thank her for gracing particularly this last webinar, which was critical in summing up all our activities all over the time that we have been meeting. At this point in time, let me wish you well and agree that we are going to take the commitments that come from here forward with our other countries on the continent, but also disseminate a summary of all these activities to all the participants. Let me thank you indeed. And as it marks 1701, on my clock here, losing my time. We knocked the 2-hour time limit, and I thank you all. All the best. The webinar is adjourned.
Thank you
very much
for moderating so well, sir.
Yes.
Thank you indeed.
Thanks.
Thank you.
Thank you.